Hi everybody, I'm very pleased to talk to Beth Westaway and Fiona Mutch today, who are both clinical nurse specialists for the Man Van project at the Royal Marsden NHS Foundation Trust. The Man Van project is an outreach programme that provides free health checks for men aiming to improve early diagnosis of prostate and other urological cancers. The Man Van is a mobile health clinic supported by the Royal Marsden Cancer Charity. Current data from Prostate Cancer UK shows that every 45 minutes, one man dies from prostate cancer, and that's more than 12,000 men every year. So the Man Van goes out, visits workplaces and community organisations to improve early diagnosis and healthcare access for men. Evidence shows us that men are less likely to receive regular health checks and are at risk of having cancer diagnosed later when it's more difficult to treat. This urology diagnostic team won the Royal Marsden Award for pioneering change, so well done, both of you. And this video today is part of a series on inspiring nurses and innovative initiatives that are positively influencing either patient care or staff learner experiences. And I've chosen just a few projects to highlight on my playlist on YouTube as I'm interested in these areas. This project really supports people like my dad, who came over from Ireland in the 1960s with limited education. He had to get a job at 14 and he worked on building sites all his life, and he never went to a doctor unless he had to. So he would have been the sort of person that this Man Van project could potentially have reached to diagnose prostate cancer earlier. The urology diagnostic outreach clinic using a Man Van is also a great example of a nurse-led initiative promoting early diagnosis and health promotion. So for any students wanting references on the Man Van for assignments or trainee nursing associates, the Man Van initiative started in 2014 in Wales. A 38-foot American-style motorhome was converted to bring mobile cancer support to communities across Wales. And since then, there's been clinics set up in several areas in the UK, Birmingham, Manchester and London. Fiona McCarthy wrote a paper in 2020, and it's quite a long title, so it's quite helpful for any of you with assignments. The title is How the Man Van Can Improve Cancer Diagnosis. A new project offers free health checks for men to help detect prostate and other cancers earlier. So that's a good paper to use for essays. So now I'm going to go to Fiona and Beth, who are going to tell us a little bit more about how this works, this nurse-led clinic works in the mobile van. So welcome both of you. After all the issues we've had with connections this morning, thank you. Thank you so much for your time today as well, because I know you're both very busy. So welcome. So first of all, I thought it would be really helpful for you just to introduce yourselves and give a brief overview of your career to date. So if we start with you, Fiona, if that's okay.
Yeah, hi everyone. My name's Fiona Mutch. I am currently a clinical nurse specialist working on the Man Van. I graduated in 2015 in Aberdeen in Scotland, where I worked on an orthopaedic trauma surgical ward for my first year qualified. I then moved to an oncology ward. I moved to London, where I worked in a chemotherapy day unit for several years as well at the Royal Marsden, and then I went on to do a secondment as a urology clinical nurse specialist within the rapid diagnostic team supporting patients who were going through the 2-week wait cancer pathway for urological cancers. And at the beginning of this year, I've joined the Man Van team.
Amazing. So just to tell everybody, Fiona's on the Man Van this morning. So if there's a few connection issues, we might get you could even turn the video off and just talk if it gets really bad, Fiona. But we got that, so that's really good. Well done. We got through. I think the connection's working now. So Beth, do you want to give an overview of your career?
Yeah, so my name is Beth Westaway. I finished my nursing degree in 2016. Then from there, I worked in cardiology. So I did a cardiac course. I worked through all the different cardiac wards there, which was a great experience. Before I moved over to the UK from Australia, and then I joined the Royal Marsden and worked on the medical day unit there on the chemotherapy day unit, as well as, and then I moved to the clinical assessment unit within the hospital. So it's like an acute oncology ward for patients having any side effects or any illnesses from the treatment. So we would see them there. And then I joined the Man-Van team at the start of this year with Fiona, and I've been working here as a clinical nurse specialist since then.
Thank you. So, so Fiona, if I start with you, where did the idea for the project come from in Southwest London? Because it's you're based in Southwest London, where you work, and how did it evolve from that initial idea?
Yeah, so the idea actually for this man van originated in Birmingham. So we actually currently have the van on loan from Birmingham. It was an idea from a patient who I believe was diagnosed with prostate cancer, and he fundraised for the van. Unfortunately, because of the pandemic, I believe the plan there had to be stopped temporarily, put on hold. But our professor here, who is in charge of the man van at the Royal Marsden, moved from Birmingham to London, so took the idea with him. So we currently have the van on loan till the end of the year, and we have predominantly been Southwest London until now. We have just recently moved to sort of West London, and there are plans to potentially go a bit further northwest too, but predominantly up until now we've been in Southwest London. We have the van on loan from Birmingham, so it will be returned potentially the end of the year. However, there are plans in place to find a new van.
Okay, and we'll talk a bit more about funding as well later, these projects, because they need funding, like you said. So I'd envisaged that my dad would be the sort of person who you'd be targeting, like a working class builder. He smoked too much and he avoided doctors. So talk me through who you're targeting and where you set your clinics up, Fiona.
Yeah, so we are seeing men over the age of 45. We have been going to areas of sort of low socioeconomic areas. That's where we know people aren't presenting as much to their GP. So we've been at community centres, we've been at construction sites, we've been at recycling centres, we've been at hospitals, we've been at churches, we've been at health centres. Most recently, we've been in IKEA. We've been at a football stadium, and we're now currently just based on a sort of Broadway outside the town hall. So we're very much trying to make it close to people for their area of work. Where they can attend. We've found actually lots of places we've been. Employers have been sending out texts encouraging people to go for the appointment, which I think for lots of men to get time off to go for appointments isn't always possible, especially in certain jobs. So actually, if there's employers there encouraging them through their sort of internal comms to come to the appointment, it's really good. So yeah, we've been sort of all over. But yeah, men over the age of 45 we have been seeing.
And you mentioned going to football grounds, for example. So just tell me, do you do it with other people? So you're in the van today. So look, sort of safety wise, if you're going to a football match, there's lots of people drinking, for example. What do you have to think about sort of safety wise and sort of like being a lone worker? Is there always somebody with you? Because I know Beth's not. Yeah.
Yeah, there are always myself or Beth. We are the two CNSs, so we're kind of like ships in the night. We never actually see each other, but we both have there's two coordinators who come on and they're great. They work as a sort of dual role of healthcare support worker and admin, and very much support us through the clinic. We're not a walk-in service, so I think that keeps us a little bit safe. We are currently, as I'm sure you can hear, parked on a very busy road, so we get a lot of foot traffic, and a lot of people are really interested. We put up a QR code and hundreds of men have signed up through that, and a lot of people have a lot of questions. We usually try and speak to people who are passing by off the van as much as possible, but on the van there's always two of us.
Amazing. So Beth, if I move to you now, so thank you, Fiona. That's a great introduction. So lots of Oh, actually, I'll ask you this one instead. Please, can you talk me through what you would do in your clinical nurse specialist role? Because a lot of early career nurses and students watch my videos. So on a typical day in the man van, what would you be doing?
Yeah, so each day, as Fiona said, all of our patients are pre-registered. So they've been booked in and they have appointment slots. So we aim to see about 20 patients in a day, and each man has a 20-minute time slot. Within that time slot, they come in, they sit down, we do a comprehensive health assessment on them for general health. So we do their blood pressure, check, their pulse and their oxygen sats, picking up any hypertension, any tachycardia. A lot of men do come on and they're quite nervous, so we do find a lot of hypertensions when they come on. So just talking them through that, finding out if they do have any health history, any cardiac history, is very important for sort of our assessments. We also do a height and weight on these gentlemen, which calculates their BMI, and from that, discussing any lifestyle changes. Obviously, men that are in that, upper overweight, obese category at high risk of having other comorbidities. So just discussing that with them. If their BMI is above a certain level, we are able to offer them a diabetic blood test. So that's quite good, just discussing that with them and offering that if they've not had one done recently or don't have any known diabetes, pre-diabetes, these kinds of things. We also give them, before they come in, they fill in an online form, which is quite extensive but very useful for us. On that is a form where they fill in on their urinary function. So we get them to fill in that. And if their urinary symptoms are quite severe, we do get them to do a urine sample, and we just check for any signs of infection, any blood in the urine. If that does pick up any like signs of infection or blood in the urine, we send off a sample just to rule out any infection, and then get back to them with the results, down the line in a telephone clinic that we do on another day. Once we've sort of gone through all of their general health, we sit down and discuss these forms. So one is on their urinary function and their erectile function. We go through that in quite a bit of detail. Obviously, our focus is on prostate cancer. So if men are having an enlarged prostate, they may have quite severe urinary symptoms. So we talk through that, discuss what their drinking habits are throughout the day. If they're drinking extensive amounts of caffeine, fizzy drinks, alcohol, that can contribute to having poor urinary symptoms. So we go through all of that with them. And from that, we discuss obviously prostates and prostate cancer risks. We offer another blood test, which is a PSA, which is a prostate-specific antigen. It's the protein within the prostate. It's a blood test that can give us an indicator for a number of things. One is prostate cancer, but it's not specific for prostate cancer. It could also be an enlarged prostate, infection, inflammation, so a few things. So we go through the pros and cons of this blood test. And then if the gentleman is happy to go ahead with the blood test and they meet the criteria and are eligible, then we offer that and perform that blood test for them, and then let them know, and we'll have the results for that blood test. So, and that is when we book them into a telephone clinic, and that's on another day where we go through all of the patients we've seen, anyone we've done urine samples on, anyone we've done blood tests on, and give them their results.
So it's amazing. So what you're looking at as well is not just urological. You're looking at the patient as a whole. You're looking at physiological assessments and history taking, and picking up things like diabetes, hypertension. So there's a real health education and health promotion aspect to the role. So you've really shown that, Beth. And you did mention about telephone clinics, and I don't know, Fiona, you want to answer this, but or how would because a lot of students and early career nurses working with clinical nurse specialists, when they work alongside them, shadow them in placements, for example, they don't realise how much administration there is for a start, but also how many telephone clinics, for example, they might do. So do you want to just tell us what you do in a telephone clinic, Fiona?
Yeah, absolutely. So we have 2 telephone clinics a week. Usually I will do one and Beth will do another. And that's where we are looking through the results of all the men that we have seen on the van. So as Beth said, we see about 20 men a day. So not everyone may be entitled to or may opt to proceed with a blood test, but it can be anywhere up to sort of 100 men who need results. So we have to go through the results. We have to look at whether or not they are within our recommended thresholds and what our advice would be. So that can take a lot of time, and this does often take quite a lot of sort of decision making. It's a really good skill to have. You're sort of using your own initiative as to whether or not you think that they require further investigation. Anyone who is being discharged with normal within range results receives a text message, but we do write to everyone's GPs. So again, it's been a great skill to learn how to sort of communicate, whether you want further tests to be done, whether you want the GP to repeat. It's really good because it gets you thinking about how you want to word things, how you ask for other services to assist you. For anyone with abnormal results, whether that is the diabetic test or the PSA, we do give them a call. No one ever wants a call from me. I don't take it personally, but they always say, "Oh, Fiona, I didn't want to hear from you again." If it is the diabetic test, we give them a call and we can let them know that it either demonstrates pre-diabetes or diabetes, depending on the levels. That's another good opportunity to do some health advice. For lots of these people, they may not have seen their GPs or any health professionals in years. So yeah, it's a good time to just hone in on the importance of sort of a well-balanced diet and exercise. And then we encourage them to make an appointment with their GP to discuss. For some, they may require sort of medication treatment for this. So we just give them our advice. And then again, we sort of write a letter to the GP. For gentlemen with an elevated PSA, we do then need to give them a call to let them know. This is quite a stressful time for them. I think a lot of men come to the van and hope to just have the blood test and that'll be that. And actually, you are now telling them that more investigations are required. So this part of the telephone call do take longer. You do have to take your time because it's very sensitive and it is an emotional time for them. Although we have explained that the PSA doesn't tell us everything, their mind automatically does go to prostate cancer. So it's a good time to go through the PSA again and what it means. Again, we take a sort of thorough history. This is because
oh, the connection's gone, hasn't it?
we want either to other trusts.
Okay, you're back again now.
Am I back?
Carry on. Yeah.
Sorry about that. At this point, we have to refer them on. So we do need to take a thorough history of sort of all their past medical history, medications, allergies. Again, we will have done this on the van, but often you don't get everything you need. So it's really good to have those sort of history taking skills. And again, it's a good time to tell them sort of what the next steps will be, answer any questions or concerns. It's actually a part of the job I really enjoy. It's really difficult, and men are often very worried, but actually you can take the time to explain things to hopefully just relieve that unease slightly. So yeah, we phone up and then we send a referral off, and again, that's really good at building the communication skills because you're often writing to consultants at your trust, at other trusts that you don't know, and you want to make sure that you're sending a good referral that that is easy for them to follow and that they have a good patient history there.
And one thing I was going to ask, Beth, you do make sure they have a face-to-face later, don't you? You mentioned that you get them to come in as well, don't you, to do face-to-face later for more further tests or whatever. It's not just all done on the phone. Sorry, not Beth, Fiona, sorry. It's not all just done. You know, you were saying you do the telephone clinic, but then there's also a follow-up face-to-face, isn't there?
Yes, so they will then be seen face to face. If they have come to us at the Royal Marsden, myself and Beth often attend that clinic, so sometimes we will get to see them again. Obviously, if we do refer them to an external trust, we do just pass them on there, but they always do have our number if sort of any concerns.
Yeah, but they get a face-to-face consultation later, don't they? That's the key. So that's brilliant. So thank you for that sorry, thank you for that overview of the telephone consultation. That's brilliant. So I'm going to move to Beth now. So have there been any challenges in the role when you're doing this outreach? Obviously, there's the internet, which nobody can, it's nobody's fault. It just goes, doesn't it? It's the same though if you're in a hospital, actually. We all use virtual, don't we? But what are the main challenges in the role and how do you deal with those challenges, Beth?
Yeah, so obviously the internet, whenever we do sort of site moves, we have some challenges with making sure that the power's connected when we arrive, and also working remotely. The van does move around, as Fiona said, to many different locations. So figuring out sort of logistics of how the team clinically are going to get to these sites on time as well can sometimes be a bit challenging. Within the role, I suppose, as a nurse specialist, one of the challenges sometimes could be your time management. As we said, we see 20 patients within a day, and each patient, has 20-minute time slots, but different things happen through a day. Some men have a more extensive health history that we want to give every man that time to go through that history correctly, really listen to them. Some men do turn up later. Obviously, we sometimes struggle to get to, work at 8:30 on the dot. Sometimes it is a bit challenging to get to the appointment time. So if men are running a little bit late or early, there can sometimes be that bit of overlap. So it's just sort of understanding how to reassure these men if we're running behind, trying to sort of shimmy your time management around. We have to check the patients in and ensure all their details are correct. I usually try to do that at the start, but if we're running a bit behind, I often try and do it at the end and get the next men in, and our coordinators can kindly check them in in our sort of little foyer waiting room. I guess the challenge with that is that we do have a courier that comes in the evening to collect all of our blood samples to take them off to the hospital to be tested. So if the afternoon clinic's running a little bit behind, you do have that pressure and that worry about the courier. So just trying to stay calm and still give all of those men that time that they deserve in that clinic appointment, and not let them think that you're rushing them through, I think is really important. Sometimes it can be challenging if you're feeling a bit stressed and overwhelmed, just trying to stay calm and know that it'll be fine, and then just reassuring them. And that's sometimes a bit challenging when you're out there by yourself with the time management.
Yeah, so thank you. So Fiona, projects like this have to be sustained by funding. So could you talk me through how the project was funded historically and how it's going to be funded in the future potentially?
Yeah, so the van was originally, as I said, fundraised in Birmingham by a patient, and I believe that was sort of music concerts and all things like that, really fun. When the van came down to London at the end of 2021, it was then funded by Royal Marsden Partners for the first year, where it was in its sort of pilot phase. At that point, there was just one advanced nurse practitioner and one coordinator. However, at the end of 2022, it was presented to NHS England as a project, and we are now funded by NHS England. Because they have backed it, they wanted to make it even bigger scale, which is why we now can sort of see up to 100 men a week. So for that, we needed a bigger team. So myself and Beth are two clinical nurse specialists, and we have two coordinators, and we occasionally will have sort of someone as bank, and from that we're able to afford a sort of project manager who is involved in finding the sites, making sure the sites work. So yes, we are NHS England backed until the end of the year, but we are currently sort of presenting our data and showing whether or not we are a effective service, effective use of NHS England's money, and then we will go from there. But I know when we were backed last year, another service similar in Manchester sort of was set up. So hopefully we can all sort of prove that what we're doing is worthwhile work, and services like us will continue.
Oh, I hope so, because you're doing such wonderful work. So finally, really, Beth, if you can just talk through the impact you're having. So do you think, have you got any statistics or data evaluating the work and the impact that you're having? Oh, you're
Sorry, I was muted.
That's okay.
Yeah, so within the team, we've found lots of prostate cancers. We've also recently found one bladder cancer, which is, bladder cancer is very rare. It equates for about 5% of the population. So, discovering that within the community, was, so interesting out in the van to be able to discover that. As well, we've found, as I went through, we do a general health check. So we've found loads of hypertensions that, these men not going to the GP, that's been a very big impact on their overall general health. And lots of diabetes, men that will go on to probably have to be medicated for these diabetes. So that's been an amazing impact to be able to find that in the community when they may not have gone to the GP for, a few more years down the line and not have that picked up. We've also had lots of patient feedback. We get sent out surveys, and one of the ones that we have, which I think is sort of a common theme of feedback that we get, is a man said that he was seen very promptly and dealt with in a very efficient, friendly manner, and then he was subsequently referred through to a hospital where he had a number of tests, including an MRI scan, and then a couple of days from that received a call from one of the doctors to say that his condition was thankfully not cancerous, but he was very impressed with the quick and efficient way the scheme operated, and reduced his anxiety to a minimum. So I think that, just as a general theme, is that we are seeing these men, we're reviewing their results very promptly and then referring them on quickly on a 2-week wait pathway. So even if it is something non-cancerous, they are still seen. Sometimes they're having severe urinary symptoms that are able to be addressed in that clinic appointment. And then if it is something cancerous, we are detecting that, as we say, very promptly. It's usually they're seen within a week. They receive their results within a week of seeing us and then referred on a 2-week wait pathway. So the efficiency is really great to have an impact.
And then just finally, can you just, because there's going to be a lot of students and early career nurses that are going to aspire to what you two want to do. So can you just give them 2 tips, 1 or 2 tips, both of you? So if I start with Elizabeth.
I would definitely say just if you see any job roles that you think, are out of your reach, that you feel a bit, nervous to apply for, I say definitely just give it a go, apply, for those roles. I saw this role and thought that there's no way I'd be able to get this role, seemed so unachievable, and should I have not applied and, done the interview, then I wouldn't be where I am now. So don't let the fear deter you for applying for things. And even if you don't, get that role, the interview experience is always really great. Even just the application experience and practicing that is really good for your sort of future development.
The great advice there, Beth. And what about you, Fiona? What would you say for someone aspiring to do your amazing job?
Similar. I think when I started with the urology diagnostic team, it was a secondment. So I would always really encourage people to go for a secondment. At the time, it wasn't really that I thought I wanted to leave my job. I was very settled. I had a lot of pals there, but a secondment came up, and it's a great opportunity to trial something out. Even if you don't know if it's exactly for you, you might find your feet doing something. And I loved it, and I was so glad I did it. And as a student, I did sort of secondment placement opportunities elsewhere. I think you should always grab these things with both hands. And if you're ever offered study days or other learning opportunities, these things all just help shape you, and they're all just so great to have for, again, just life experience. We now go out and chat to however many men a day, and I can't say how much it builds up your confidence. Then doing telephone calls, all these things help. And then any additional study is great. You learn so much, you meet new people. It also gives you things to talk about in interviews. So yeah, absolutely, just always grab any opportunity that's offered you.
The fantastic advice from both of you. So just to say thank you for giving us your time today. You're amazing, both of you, doing some wonderful work. I hope you get future funding and keep this going. And thank you for everything you're doing for nursing as well. So thank you for your time today.
No, thank you.
Thank you.